Hi everyone, good evening and welcome to my channel. My name is Dr. Wang and I'm here today to talk about diabetic ketoacidosis. First of all, I would request that you subscribe to my YouTube channel, like it and make your comments. I'm more than happy to respond to all your questions with regards to this video. So here, let's go. Diabetic ketoacidosis is a serious complication of diabetes. The condition develops when the body can't produce enough insulin. Insulin plays a key role in helping sugar, a major source of energy for the muscles and other tissue, enter cells in the body. Without enough insulin, the body begins to break down fat as fuel. This causes a buildup of acids in the bloodstream called ketones. If it is left untreated, the buildup can lead to diabetic ketoacidosis. Now let's look at the symptoms. So the symptoms here are quite interesting. So here we go. Diabetic ketoacidosis symptoms often come on quickly, sometimes within 24 hours. For some, these symptoms may be the first sign of having diabetes. Symptoms might include being very thirsty, urinating often, feeling a need to throw up and throwing up, having stomach pain, being weak or tired, being short of breath, having fruity scented breath, being confused. Now, when to see a doctor, if you feel ill or stressed, or you have had a recent illness or injury, check your blood sugar level often. You might also try a urine ketone test kit you can get at a drugstore or a pharmacy. Contact your healthcare provider right away if you are throwing up and can't keep down food or liquid. Your blood sugar level is higher than your target range and doesn't respond to home treatment. Your urine ketone level is moderate or high. Seek emergency care if your blood sugar level is higher than 300 milligrams per deciliter or 16.7 millimoles per liter for more than one test. You have ketones in your urine and can't reach your healthcare provider for advice. You have many symptoms of diabetic ketoacidosis. These include excessive thirst, frequent urination, nausea, vomiting, stomach pain, weakness or fatigue, shortness of breath, fruity scented breath, and confusion. Now, with regard to the causes, sugar is the main source of energy for the cells that make up muscles and other tissues. Insulin helps sugar enter the cells in the body. Without enough insulin, the body can't use sugar to make the energy it needs. This causes the release of hormones that break down fat for the body to use as fuel. This is also lead to the production of acid known as ketones. Ketones build up in the blood and eventually spill over into the urine. Now, diabetic ketoacidosis usually happens after the following condition: an illness. We talk about an illness here. It could be an infection or other illness that can lead to the body to make higher level of certain hormones such as adrenaline or cortisol. These hormones work against the effect of insulin and sometimes cause diabetic ketoacidosis. Pneumonia and urinary tract infection are common illnesses that can lead to diabetic ketoacidosis. The other one is a problem with insulin therapy. Missed insulin therapies can lead to little insulin in the body. Not enough insulin therapy or an insulin pump that does not work right also can leave too little insulin in the body. Any of these problems can lead to diabetic ketoacidosis. Other things that can lead to diabetic ketoacidosis include physical or emotional trauma, heart attack or stroke, pancreatitis, pregnancy, alcohol or drug misuse, particularly cocaine, certain medicines such as corticosteroids and other diuretics. Risk factors. The risk of diabetic ketoacidosis is higher if you have type 1 diabetes, often missed insulin doses. Sometimes diabetic ketoacidosis can occur with type 2 diabetes. In some cases, diabetic ketoacidosis may be the first sign of having diabetes. Now, let's go to the complication. Diabetic ketoacidosis is treated with fluids, electrolytes such as sodium, potassium, and chloride, and insulin. So essentially, there are three things here that can be used at the same time because you need to balance their value in the blood. That's why you find three things here. So you have the sodium, potassium, chloride, and then the drug itself, insulin. Perhaps, surprisingly, the most common complications of diabetic ketoacidosis are related to this life-saving treatment. Possible complications of the treatment. Treatment complications include low blood sugar, also known as hypoglycemia. Insulin allows sugar to enter cells. This causes the blood sugar level to drop. If the blood sugar level drops too quickly, the drop can lead to low blood sugar. Low potassium, also known as hypokalemia. The fluids and insulin used to treat diabetic ketoacidosis can cause the potassium level to drop too low. A low potassium level can affect the heart, muscles, and nerves. To avoid this, potassium and other minerals are usually given with fluid replacement as part of the treatment of diabetic ketoacidosis. The next one, swelling in the brain, also known as cerebral edema. Adjusting the blood sugar level too quickly can cause the brain to swell. This appears to be more common in children, especially those with newly diagnosed diabetes. Untreated diabetic ketoacidosis can lead to loss of consciousness and eventually death. Now, how can this be prevented? So we'll go into this part, which is also very important. There are many ways to prevent diabetic ketoacidosis and other diabetes complications. The first one is managing your diabetes. Make healthy eating and physical activity part of your daily routine. Take diabetes medicines or insulin as directed. The next one is monitor your blood sugar level. You might need to check and record your blood sugar level at least 3 to 4 times a day or more often if you are ill or stressed. Careful monitoring is the only way to make sure that your blood sugar level stays within your target range. Adjust your insulin dosage as needed. Talk to your healthcare provider or diabetes educator about how to make sure your insulin dosage works for you. Consider factors such as your blood sugar level, what you eat, how active you are, and whether you are ill. If your blood sugar level begins to rise, follow your diabetes treatment plan to return your blood sugar level to your target range. Check your ketone level. When you are ill or stressed, test your urine for excess ketone with a urine ketone test kit. You can buy test kits at a drugstore or a pharmacy. If your ketone level is moderate or high, contact your healthcare provider right away or seek emergency care. If you have low levels of ketone, you may need to take more insulin. And lastly, be prepared to act quickly. If you think you have diabetic ketoacidosis because your blood sugar is high and you have too many ketone in your urine, seek emergency care. Diabetes complications are scary, but don't let fear keep you from taking good care of yourself. Follow your diabetes treatment plan carefully. Ask your diabetes treatment team for help when you need it. Thank you so much for listening to me. I'm Dr. WAN and I look forward in answering your question. Please do not forget to press that button to subscribe to my YouTube channel for new videos and any update. Thank you so much and may I wish you a wonderful evening. Ciao.